So I will turn the time over to Kate and Anita.
Thank you. Thanks. Thank you so much. So a lot of what we're discussing today, we do have information and resources right now in the room. So if you haven't checked out the tables around the room, please feel free to do so. I know personally what I've stocked in the back two tables. So we do have information, as Ronnie had mentioned, about participating in clinical trials. That's that trial match brochure you'll look for. For those going through the diagnostic process, again, we have that diagnostic flyer, information on medications. We have that in our basics brochure. We had a question about the warning signs. That's our Know the 10 Signs brochure. There's sections there. There's a whole safety section, and you can grab a physical handout as well as brochures. And so we have that, and we'll be kind of going through those right now. There's a behavior brochure, communication brochure. There's handouts on different behaviors as well. Information for a person newly diagnosed or in the early stages of a dementia. Information on activities of daily living like bathing and dressing and toileting and those kinds of things. So really feel free to pick through and grab as much as you want. We can replenish as needed. Okay? Anything else you want? Okay, so with that, we'll go ahead and get started. So these are the, let's see if we can adjust this. I zoomed a little too much last time. Maybe Bree can help us with this. I broke it. Leave it to me. Let me zoom this back out a bit. So these are the common safety concerns that we're going to discuss today. Thank you. Driving, that's a big one. Medication safety, wandering, as Luann mentioned, firearms, and traveling. Okay, there are additional safety concerns, thank you, as well, but these are the top 5 we're going to get to. So driving. So driving, as you can imagine, especially in Utah, requires good judgment. I moved here 4 years ago, and I've seen quite a difference in drivers here than in the many other states that I've lived in. So what's required when it comes to driving is good judgment, to be able to react quickly. If somebody were to walk out in front of us, somebody were to swerve in front of us, we come to a light, those kinds of things. Split-second decision-making. In the event something happens, how do I adjust? How do I get out of that scenario? Navigation skills, to be able to find your way back home safely or get to wherever it is that you're going. And then, of course, concentration. So because of all this and because of what we've learned so far about progressive dementias, we know that all of these areas are going to be challenged with dementia. And so therefore, eventually, every person living with this progressive neurodegenerative form of dementia will be unable to drive. That's hard for people to hear because driving represents so much independence, and so that's very tough. And so let's first talk about signs of unsafe driving. So I was in one of my caregiver support groups one day, and we had a new lady that joined us, and she asked the group, how do you know when it's time for the person with dementia to stop driving? And another attendee jumped up right away and said, well, let me tell you, this is how I knew. It was when my wife wrecked her new second car, which was a Jaguar, as she was driving down the mountain. That's how you know. And so I personally wouldn't recommend waiting that long. So here's some signs of unsafe driving. So first and foremost, forgetting how to locate familiar places. That's tricky, okay? Failing to observe traffic signs. Now, if you're from the Northeast, specifically I think it's in Pennsylvania and New Jersey, they don't really stop at stop signs. They do a pause and then a turn. So if you've always done that, that's one thing. But if now you're progressively getting worse with observing our traffic laws, that's certainly a problem. Making slow or poor decisions in traffic. Again, you have to be able to process quickly, as Luann mentioned. It's a processing disorder. If you can't think and process quick enough to react, there are going to be accidents, there are going to be challenges. Driving at an inappropriate speed. Many of us will slow down and turn down the volume when we're looking for something, right? We do that too. But we'll slow down when we're trying to concentrate, or we're not heeding the speed limit. We're going much too fast. So we watch for that. Becoming angry or confused while driving. Many individuals with dementia, they are very aware that they're having challenges, and that will upset them even further. That they're not able to process or think through or problem solve through this issue, and it's becoming apparent to other individuals, which then is very frustrating for them. Hitting curbs. So watch the rims. What's in the car? What's in the tire? Oh my goodness. Look for the side of the car and along the tire for any nicks or dings or gashes in the rims, whatever that's called.
Rims.
Rims, thank you. Using poor lane control, not being able to manage not only yourself in the space of this car and all the buttons and all the things that you have to watch, but your car on the space of the road and multiple lanes and how you're going to navigate that. And then making errors at intersections. You mean to go this way, and so you're crossing over several lanes, or you're not watching for crossing traffic. Confusing the brake and gas pedals. Another important one, as you can imagine. Returning from a routine drive later than usual. So that indicates they either got completely lost or it took them longer because they needed that longer processing time, that concentration time. And then finally, forgetting the destination that you're driving to during the trip. So that's another big one. So this is a difficult decision to make. As I mentioned, driving signifies independence. How much will that person's world completely shrink if they no longer have the ability to drive now? When is the right time to, go ahead.
I have one more to add.
You have one more? Okay.
When they stop, when they're driving and you start to talk to them, and they stop in the middle of the road so that they can understand what you're saying.
Ooh, that was a good one. Did we hear that one? So when they're driving and you turn to talk to them, and because of that processing, they stop driving altogether so that they can focus on what it is you're saying. That's another one. I'll add that in there. My goodness. Anybody have any others that are good? Yes.
We had the experience where my husband was on the road in Tokerville.
Mhm.
I don't know if anybody's familiar, but there's a part that's very wavy and going downhill. There's been several wrecks on it. My husband was driving his truck, and I noticed we were getting closer and closer to the cars in front of us. Usually there's not that much traffic, but this night there was, and it was night. And I realized he wasn't going to stop. He was pushing, almost literally pushing the car in front of us. And so I automatically hollered, "This is not working, you can't do that." And his reasoning was, the sign said 60 miles an hour, and they were not going 60 miles an hour. And that not only drew the line for me, but I think it was the first time he realized he couldn't drive anymore.
Yeah.
I think it scared him.
Did everyone hear that? So driving down a windy road in Tokerville, and there was more traffic than normal on the road, and it was nighttime, and so he was not slowing down as he was approaching other cars, almost to the point of tailgating them and pushing them further. But his reasoning was, well, the sign said 60 miles an hour, and that's what we're supposed to go. So judgment, okay? And yes, he was observing traffic signs, so that's good. But yes, you have to consider all of those conditions. Did we have another one over here? Did you have one? Somebody else? Oh,
I
yeah.
was just going to say, sometimes people think if they keep driving faster, that the person in front of them, they can push them along, at least mentally. They think, you know, they're in a hurry, so if they get up there close, they can push them
Okay.
along, but it doesn't work.
Right. Just because you want somebody in front of you to go faster doesn't mean you
Follow
can physically
closer.
do that by getting very close to them. Absolutely. So good examples, So when is the right time to stop driving or to even talk about not driving? This seems to be a question, I can tell you, that comes up quite often. Every time there's a new caregiver in one of our caregiver support groups, they always always ask that when is the right time, which tells me they're already seeing some things. They're just not sure when to go through that. So we certainly go through this list and we talk about that. But what can happen more often than not, versus just saying, okay, you're right, it is probably time right now, what I'll hear from people is they'll make excuses for that individual with dementia. They'll say things like, well, it was really heavy traffic, really wasn't his fault, or that other driver, kind of cut him off, and or they really weren't driving in a familiar place, and those kinds of things, to kind of make excuses for that individual. And so it's really not until some of my more seasoned caregivers who've been in that group for a while chime in and say, and ask, would you let your grandchild ride in the car with them? That's usually the question that gets people to pause and really think. So if that's what it takes, let's add that to the list of things to consider is, would you feel safe with your grandchildren riding, or whoever you love, if you're, if you don't have grandchildren, your favorite dog, whatever it might be. Would you feel comfortable? Would you feel safe having that individual in the car with them? And if the answer is no, then it's probably time. Okay? Go ahead.
My biggest problem is that my dad always drove and my mom did not drive.
Okay.
And my dad was a professional truck driver, all these awards and everything, and now she's the one that has to drive. And so he wants to still drive, even though we checked all these and the doctor told him no. He still fights her every single day.
Okay.
And it's hard for her to fight back. She reasons, like you said, well, it's just close. It's just the back roads to something. Or say, no, you can't give in once, because then it's just like a 2-year-old. He'll get worse, and he'll try harder, give temper tantrums. If you let him drive one time, when you said no, you say no that to it. You can't let him do it sometimes.
Right. So did we hear that? So Dad was a professional truck driver and always drove his entire life for Mom and Dad. And now that he has dementia, he's not supposed to be driving, so Mom is driving. But because that was Dad's identity, he has difficulty with that, and he's constantly pushing to drive. So we'll pause on a second for that, because I think we're going to get to that in the next slide or two. So just an FYI, there's information in the safety packet on driving, and we have a Dementia and Driving Resource Center as a portion of our website, because it's that important of an issue. So what you'll find here when you go to this section is tips on how to discuss dementia and driving. There are videos actually that you can watch, the signs of unsafe driving that I went through, and then talking about alternative options for driving. So there's even a driving contract that you can print out, and you might think, oh, it's never going to work. It works. So not everything works for everybody, but everything's worth a try, right? So with this driving contract, I'm paraphrasing, but it's in that safety packet, is basically says, I, so-and-so, recognize that because of my dementia, at some point I will have difficulty driving and it will be unsafe. So I designate this person, put their name in, to be the person to talk to me about that when it's time, and they sign that. And then the other person, who was designated as the person that can, or the person that, the other person signs at the bottom and says, I, so-and-so, agree to have that conversation with so-and-so, my loved one, when it's time, when I'm concerned. And then they sign it. And so you have that discussion early, and that's really when it's best to start this discussion as early as possible, so that you can all be on the same page at the same time. But you have that discussion, you sign that contract, and you file it away. And when it is time to have that discussion, if you're met with resistance, you can pull that out. And in that individual's own handwriting, they're seeing their name and their signature. So it makes it more plausible that they will agree and listen to that. Doesn't always happen, there's always some things that can happen, but that's a great way at least to start the conversation, of course, in looking at these videos. So I facilitate a support group for those in the very early stages of dementia, and we talk about driving at our meetings. Currently, half of the individuals drive themselves to the meetings. They have gone through the extensive driving evaluation done by occupational therapists. They've been given permission by their physician to continue driving because they're okay still. The other half of the individuals don't drive, and so their family members drop them off. For the most part, that's what will happen. But many individuals have decided, well, I'll tell you this, for those that aren't driving now, it's either because, yes, their physician said, no, it's not a good idea. I can tell by the symptoms that you're experiencing that driving would be impaired right now. Others have voluntarily said, I don't want to drive. They've said, I don't want to be the cause of an accident. And so many times bringing up that, what if something were to happen? What if somebody were to get hurt? That is enough, again, to make people pause and to really think about, should I be driving or not? So many will say that I don't want to be the reason for someone to get hurt, and so they voluntarily hang up the keys. Others will say, you know what, even if I'm not the cause of an accident, but I'm involved in an accident, because my diagnosis is in my medical records, an attorney can find that. If the other party hires an attorney, they can find that, and that can be used against me, and then before you know it, it is my fault, when it really wasn't. So there's a lot of individuals that are worried about that type of exploitation as well. So these are things that you can bring up to consider. Actually, one of my gentlemen in the group takes an Uber to our support group meeting because he's not quite there where he's okay with family driving him. He wants to manage the Uber and be independent with that and get himself to the groups. So that's another alternative method, and we have transportation resources in the community as well. So we'll keep going because we're going to run out of time. I'm so wordy. So when someone is still resistant about driving, there's some tips that you may bring up. So in your example, where that's dad's identity, he's always been the driver. When I work with families, specifically the woman is where this will come in, the lady of the house, I will suggest that she make a comment like this. You know what, because you've always driven, I feel like I'm not a very good driver. I feel like I need more practice. And I think I would do better if you're sitting side by side with me and kind of helping, but I think I need a little bit more practice. And especially if something were to happen to you tomorrow, how in the world would I get around? Could I please drive? Because I think I could use some practice in that regard. And you'd be surprised how much that will work. So there's one example there. There have been times where it's helpful to have someone else in the car while myself, the person without dementia, is driving. There's another person in the car to kind of distract the individual with dementia so that they're not so focused on why am I not driving, that kind of a scenario. So in the event that somebody is extremely insistent on driving, we might have to go a little further, okay? And sometimes we have to be creative. So first and foremost, I've had families do this to actually notify law enforcement when their loved one leaves the house in the car, and encouraging them to issue a citation. Asking the doctor to write a prescription, that do not drive prescription, or it's asking the physician, of course, to help you have that conversation. Controlling access to car keys. How many sets are there and where are they? Can that individual access easily those keys? Disabling the car. There are many ways you can do that. An example here is the distributor cap or the battery. Be careful though, because individuals with dementia are just like any individuals. We're resourceful. And so I worked with a family whose mother, they disabled the car, the battery, in the driveway. And mom tried to drive and couldn't because the car wasn't working. So she called the local auto place, and they came out and fixed the car for her. Easy fix. It wasn't that nice of them. And so after a couple times of her calling the auto place to come fix the car, the family finally put a note inside the hood, don't fix the car, please call us instead. And then they told them the scenario. So sometimes you have to be extra creative. Instead of leaving the car in the driveway with the car disabled, how about if we remove the car so that it's not a cue now to that individual that, oh, I've got this car, maybe I need to go somewhere. So I've worked with folks where we've determined if there was someone in the family that could really benefit from the use of that car, and then we ask the individual, could that person borrow it for a period of time? Those kinds of things. And so then we remove the car from the property. So removing that, it then kind of loses its appeal. Or of course, as I mentioned before, that evaluation. So if necessary, you can go through a multiple hour driving evaluation led by an occupational therapist, and that really gives you a good sense as to the person's capacity and ability to drive. Okay, I'm going to pass it on over to Anita, and she's going to talk about medication safety.
Hey,
Oh, yes.
I was just going to mention that I was very lucky in that way. My husband stopped driving because his driver's license expired, and I didn't say anything until it was too late.
Okay.
I had to have a doctor and just keep quiet.
Okay.
So no longer driving.
Great. So in this case, the driver's license expired, but she didn't say anything, and then before you know it, it wasn't an issue anymore. So good. So sometimes it's that simple. Other times it's not, and again, reach out for help and support. You should know that driving evaluation is not the same as going to the DMV and doing the little test. It's much, much more thorough, and you're actually getting in the car and physically driving as well. That's a piece of it. So, okay. Miss Anita.
Thank you, Kate. I'm going to switch things around here a little bit. I did want to show everyone here the things that I'm going to be talking about that are easily accessible at the table. This is called a companion card, and I'm going to talk about that when we talk about traveling. Care Zone, which is a new app that we have. How many people here have a smartphone? It's also usable on your computer, but this is an amazing thing. And this handout, which is numerous pages, but it's all about the safety issues that we're speaking about today. And I know how important it can be to have that resource to go back to, because you've heard a lot today. And you'll be able to go back to that resource and find what we talked about and hopefully clarify a few things. So, how many people here, yes,
Where is that located, which table?
in the back table here with the Alzheimer's information?
I can bring the safety package around if anybody wants.
Okay, all right. How many individuals here are giving medications to those that they care for? And you can be giving those medications to a dementia patient, but you can also be giving those medications to another loved one who could be sick for a different reason. So medication safety is really very, very important when it comes to the health and well-being of both you as a caregiver and the patient themselves. One of the biggest issues that brings patients to an emergency room is taking medications incorrectly, or somebody giving the medication incorrectly. And for those of you who are caring for somebody with Alzheimer's disease, what's an emergency room visit like? It's awful. It's a very difficult experience for you, and it's even a more difficult experience for that person with Alzheimer's. So you don't want to get there if in fact it comes from a medication issue. So what we're going to talk about today is how to understand the medications that you're given and how to develop a relationship with a pharmacist that can answer questions for you. So when I talk about establishing a relationship with a pharmacist, I'm not talking about that gentleman who's maybe behind the counter at Walmart where you get most of your medications. I'm talking about those pharmacists that are available to you at the more private pharmacies like Stapley's. And medications that you get filled there are medications that they charge to your Part B Medicare insurance, so there's no extra charge for that. And I know myself, my husband has some medical issues, so we get most of our medications from Walmart, but those medications that are for his heart that I may have questions about, I get those filled at a private pharmacy. So I can go to that pharmacist and I can ask him questions. Because the pharmacist is the one that really gets into side effects, interactions, things that don't work well. And he has a listing of all the medicines that your loved one has. He's going to look at that very carefully before he fills a medication that might not work so well and may cause some side effects that you don't want to see. So an important thing for you as a caregiver, when you are giving medications, you need to know the purpose of that medicine. So let's say you go to the doctor and the doctor says, I think it's time to put your husband on Nederostek. And you say, oh, okay. Well, you need to say more than, oh, okay. Tell me about the Nederostek, doctor. How important is this? If it's a difficult morning and my husband won't take his pills, is the Nederostek an important one to get down? Don't be afraid to ask questions. You also need to know the side effect of the medications. As Kate pointed out to us, when she was taking care of residents in a facility, there was a resident that walked down the hall without any clothes on and pulling his wheelchair, and that was a medication side effect. So be aware of those side effects. Ask the doctor what they might be. Ask the pharmacist what they might be. How do you learn about side effects now? You get a big bunch of information with the pills. How many of you know what it is that applies to your loved one in those 4 pages? You don't know. So the person to ask is the doctor. The other person to ask is the pharmacist. When a person with dementia suffers a medication side effect, it's not a simple thing. It can develop into a huge thing. And appropriate use of the medications. So when you're giving a medication, you need to know what it's being given for, but also when should you give it? Is this a before meal medication? Is this an after meal medication? Is it a medication that should only be given at bedtime? So often when you get a medication for a patient, it says take once a day. Well, what time of the day would that be? And knowing the time of the day is very important for patients with dementia, because you may be giving them a medication that should be taken at bedtime that will help them sleep and give them a little bit of sedation. But if you don't know that, and you give it to them in the morning, and then you're thinking, my gosh, you're sleeping all day, what the heck's going on? So that's another thing to be very, very aware of. As the disease progresses, as any type of dementia progresses, how you manage medications must always progress and change. So let's say you're right now in a way to stay organized with medications. You're using a pill organizer. And your husband or your wife, they're still pretty capable of filling that organizer. You check it. And for looking at that organizer and taking the medications as they should. However, that's not going to last for the entire length of the disease. You're going to need to understand as the disease progresses and you look at the signs, you flip the lid for the pills for the day, my golly, they're all still there. Well, not remembering to take those pills anymore. So you have to go to step 2. You can get specialized packaging from a pharmacy. Now, by specialized packaging, I mean they will put each pill into an individualized cellophane packet, and that packet is labeled with the day, the date, and the time, and it's see-through. And it's usually organized by the time of the day. You can tack those on the refrigerator, and that pill can easily be taken. And when you go in to check, you can see whether it's been taken or not. And it's also easy for someone in not just early stages, but mid stages, to look at those medications and see when they should be taking them. As you know, an Alzheimer's patient, they can still read pretty well. It's just knowing when to read and when to find the medicine. Now, these specialized pharmacies do this. I know Staples does it. I think Stiens does it. There's pharmacies in Hurricane that do it, and they do it free. They charge you nothing extra for this. Are there people that use that now? That's great. So if you're thinking of doing that, you can use these ladies as a resource for that. And again, as things progress, you may look to a home health agency that might come in, that can come in and fill medication minders for the week. Or they can check and make sure that medications are being taken every day as they should be taken. And then you, as a caregiver, that can be, if that person is still living with you, that can be a kind of a relief. They are doing the medications every day. Maintaining a daily medication record. How many people do this? That's a do you do that? Okay. It's a real safety item. It reminds you that the medication's been given, because you as a caregiver can get pretty tired and you may not remember whether you've done it or not. But it also provides a record. And you can take this medication record and you can give it to the physician when you go to see him. And then he sees that you're taking the medications regularly, and if he's suspecting something might be wrong due to the medication or the lack of it, he'll see that, gosh, it's not the medication, you're taking this. And this also is a written record that includes the name, the dosage, and the time. Now, how do you get one of these? You Google it. You Google medication administration record, and hundreds of them will come up, and you can choose one that you like. They also have medication administration records, often at these specialty pharmacies, that you can use. But I highly recommend that. The other thing to consider is Medical Alert Safe Return. Medical Alert is another way of listing all the medications that you're on, and then that bracelet, if you go to the emergency room or if there's an unfortunate happening that your loved one should wander away, they can look at that Medical Alert Safe Return system, and any emergency agency can pull up the medications that they're on. Develop a routine of when medications should be taken, because a routine is so very important with Alzheimer's patients, as you've heard about all day. So a routine time for morning meds, afternoon meds, evening meds, bedtime meds. And don't vary from that more than about 15 minutes each way. And also understand that medications can easily be made a routine according to meals. You can do breakfast, lunch, dinner when you go to bed. So probably the last and most important thing is avoid risk of any kind. Don't take old medications. Some of them can be outdated, but sometimes the formula has changed. You may have a medication that was taken 2-3 years ago, and the doctor writes you a new one, you go, oh gosh, that's great. I have to get that filled. I have some at home. Well, it might not be the same formula anymore. So don't take that and don't give that. What should you do with old medications? Dispose of them safely, take them back to the pharmacy. Most pharmacies now, you just walk in, have your pills in a bag, and you can throw them in the disposable disposable area there. Never share medications. I can remember an instance where I was working with a patient, a couple actually, and they were both taking pain medications. And they were both taking Percocet. Well, not all Percocets are made the same. Some are 2.5 milligrams, some are 5 milligrams, some are 7.5 milligrams. But it just says Percocet. So they were sharing those pain medications for financial reasons and also because they didn't want to go get it filled. The husband was taking 7.5 milligrams, the wife was taking 2.5. Well, the wife ended up in the emergency room, overdosed, because she was just taking Percocet, wasn't she? Well, not exactly. So never share your pills. As the disease progresses, keep these medications secure. Keep them locked away in a locked cabinet or in a locked box, just like you would have precautions with your children. Don't leave them laying out on a table anymore. Keep the poison control number handy. The poison control number for this area is 800-222-1222. Because if you have a question, you have supplements out on the table, a bottle of vitamins, and your patient or your husband or wife takes that whole bottle because he thought they were a pretty color and they didn't taste too bad. So you can get concerned about, is that going to hurt? Is that going to cause harm? You can call poison control or call 911. But if you suspect an overdose, if you suspect that the person you're caring for has taken too much medication, or that maybe inadvertently or accidentally you've given too much medication, do not hesitate to call 911. Don't think about it twice. They would much rather you call them than when they can help and affect a difference than to. Okay, any questions about that? All righty, Kate?
Okay, thank you. So let's talk. Let's talk about wandering. That never happens with dementia, right? So 60%, I don't know if you know this, 6 out of 10 individuals with dementia will wander. Yeah, I heard, wow, you're right. That's frightening. Absolutely. And here's another scary statistic. If not found within the first 24 hours, up to 50% of individuals will suffer serious injury or death. So there's another wow. Again, think about this. Because of the challenge that happens with dementia, that reasoning and judgment and navigation, wayfinding problems, and all of those kinds of situations, the person can easily get themselves into trouble when they're wandering. So we want to find them as quick as possible. Wandering can occur on foot, by car, or other modes of transportation. You can, if you're in a wheelchair, and you can ambulate that wheelchair on your own, you're at risk for wandering. So just because somebody's in a wheelchair or uses a walker doesn't mean they won't wander. Sometimes they don't take those items with them, they'll leave it behind, then they're even more at risk, okay? So let's talk about wandering warning signs. I've always said, working with folks with dementia and their families for 17 years, I've always said individuals don't wander until they wander. You don't always get these warning signs that we're going to talk about, or you've seen them but you don't heed them as warning signs because we don't realize what could come next. And so I like those commercials that are going on these days that you're at a restaurant and you get your bill and it says, handwritten on there from the waitress, at 2 o'clock today you're going to have a stroke. Those kind of, you don't get warning signs for strokes. Or whatnot, or heed the warning signs of the stroke, I think is the point of the commercial. We don't really always get those with wandering. Sometimes the person just right away, will wander. Or again, we're not heeding these as warning signs. So here's another warning sign. So returning from a walk or drive later than usual, forgets how to get to familiar places. If they're forgetting how to get there, they're having difficulty navigating, they're probably going to take a wrong turn and then just continue down that path. They talk about fulfilling former obligations, such as going to work. I've got to get to work today. I've got things to do. Let's go. Those kinds of comments. They try or they want to go home, even when they're at home. Okay? They're seeking out that familiar location. They're restless. They pace or they make repetitive movements. This is a behavior that Luann was mentioning briefly. Absolutely, that's a warning sign. They have difficulty locating familiar places like the bathroom, bedroom, or dining room. Again, they're getting turned around. They're not able to navigate their space and find those places that they're used to, and so they'll continue down the wrong path for some time. They ask the whereabouts of past friends or family. They may actually start searching for those individuals, so that's a concern. They act as if they're doing a hobby or chore, but nothing gets done. This is not like, you give the honey-do list and it's not really quite done to your level that you would like, but it's still done. Not the same thing. The person, here's an example, they're moving those pots of dirt around, but they're not actually planting anything, so they're making a bigger mess. So they've got this feeling of, I've accomplished something or I've got something to accomplish, but they're not actually able to work through that. They act nervous or anxious in crowded areas, such as shopping malls or restaurants. So they might actually leave that space because it's overwhelming. As Luann mentioned, that agitation, that overwhelming environment, that noisy space is too much for them. So they'll look to escape that. Okay, so these are warning signs to watch for. So tips then to prevent wandering. So Luann mentioned activities. Very, very important to carry out daily activities. And as we've mentioned, a routine is very important. To have a routine structure for the day can be very helpful. Identify the most likely times of day that wandering may occur. Maybe after lunch. I hear this all the time. After lunch, I've got to get going now. Or after breakfast. They've had their breakfast and they're used to going to work right after breakfast. And so that's the time where they're most restless and ready to go and do something. So at that time, you want to plan some activities. You want to have an errand, for example, that you need to run, or something you need help with in another part of the house. Reassure the person if they feel lost, abandoned, disoriented, confused, those kinds of things. You want to reassure them that they're in a safe place. Anytime they're looking to go home or to go to work, you want to validate, we're staying here tonight. We're safe and I'll be with you and we can go home in the morning. As Luann mentioned, a little fib, but it's helpful. If it works, it works. You want to ensure all basic needs are met. Do they need to use the restroom? Are they hungry, thirsty? Are they cold? Are they looking for a warm, safe space to be in? Avoid those busy places that are overwhelming and you can cause disorientation and confusion and anxiety. Place any locks out of sight. I've suggested to families that you, instead of just the lock on the front door, we add another lock maybe up a little bit higher. For me, I can probably still see it, but others maybe not. So move the lock to another place. Or we can use a device that will alarm or signal you when a door or a window is open. Back in the day when they had Radio Shack, I used to go all the time and get those alarms that you could put, let's see if I show you here. You put one piece right here and another piece right here on the door. And there's a magnet in between. And when that door opens and that connection is broken, the alarm would go off. So that's another suggestion. Provide supervision. As dementia progresses, individuals require more and more supervision, not only for assistance with going to the restroom and meals and those kinds of things, but for safety awareness. That safety awareness decreases, they need more and more oversight and supervision. Keep those car keys out of sight, as we mentioned. Keep the car out of sight potentially as well. We don't want that to be a trigger. And then here's a a favorite from one of my caregiver support groups. So I have a gentleman named Ron, who's in one of my support groups, moved in with his father, Jim, and very tight-knit, wonderful community. And so Ron, with a great caregiver, would go around with his father, Jim, door to door, knock on the door, and say, "Hi, I'm Ron. I just wanted to introduce you to my father, Jim." He would give a flyer to the family living there with Jim's picture, and it would say, "My dad, Jim, has dementia. If you ever see him out and about in the neighborhood without me, here's my phone number." You know, kind of paraphrasing. But great system that they put into place. And so he walked around and made sure everybody was familiar with who Jim was. Great person. They felt comfortable if they were to see him in the future. And you'd be surprised how many times, Jim just needed to walk off some steam, and Ron would look out the window and watch his dad walk down the street just to kind of walk off some steam. Usually Jim would turn around and come back on his own. But before you know it, a minute or two goes by, ring, 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 he's getting phone calls from all the neighbors. So he set up kind of a neighborhood watch. "Ron, did you know your dad's out in front of the church?" "Yep, I can see him." And then a few minutes goes by and Ron would go and pick him up, or one of the neighbors would walk him back. So using that support system that you have built into your community is a great tool as well. Did we have something?
Now, do you think that neighbors sometimes could be worried or afraid of a person that has Alzheimer's or some kind of dementia, that they might hurt them or that they might break in the house or discuss that?
Yes. So the question is, do we think, are neighbors ever worried that a person with dementia might cause them harm, break into their house or hurt them? Absolutely. People can have that concern. It's mainly because they don't understand dementia. They don't understand the disease process. And so there's a great card, a long card on the table back here that says 10 ways to help a family living with Alzheimer's. And so I give this to families and I share with them, when you're sharing your loved one's diagnosis with your circled network of support, give them a card, give them one of these cards, because it explains to those individuals how they can reach out and support that family. Please feel free to give other information. Another one, a good one would be the basics brochure, communication brochure. It's really about increasing awareness so that fear dissipates. And then, being open and having that discussion with those neighbors about really, chances are when you see Dad coming to your house, he's probably heading to work. Why don't you talk to him? This is what he did for a living. Talk to him for a little bit and maybe walk him back to the house, and chances are he'll be fine. So I think if we don't talk about it, that just increases suspicion and increases fear. If we're open and we give resources and support to our friends and neighbors, then you'd be pleasantly surprised how many people will come to your aid and help you. Okay, so there are GPS tracking systems out there. GPS tracking systems tend to work better for individuals in the early stages because they have to be aware that it's important that they keep that item with them at all times. Whereas an individual mid to late stage will set items down and not keep that with them. So